Welcome to the Mission Brain Podcast, the official podcast of the Mission Brain Foundation, bringing insights into the fascinating realm of global neurosurgery.
Welcome to the Mission Brain Podcast. My name is Luca, and I will be your host. Today, we have the pleasure of having Dr. Neha Rao, a fourth-year medical student at KIMS in Bangalore, India, and secretary as well as one of the founding members at Mission Brain India. She's also the head of networking at Talento Doc, a digital magazine for medical students. Hello, Neha. It's great to have you here.
Thank you so much, Luca. It's wonderful to have you and have myself on this platform. It's a great initiative, the Mission Brain podcast, and I would like to thank you and Alice for welcoming me here.
Awesome. So right off the bat, I know you love to interview people. I watched some of your interviews, and I think they're spectacular, honestly.
Thank
So
you.
first of all, what do you think constitutes a
Thank you
good
so much.
interview, and how did you get into doing them?
A good interview is something where after the interview, you have a change of perspective or a new idea planted in your head. And it can be spontaneous, it doesn't have to have a particular theme to it. It should just be natural and it should convey something, a concept, idea, a message to the viewers. And I think Mission Brain Podcast is a great initiative for you guys to do this and get the opinion of many people around the world, their experience in healthcare and whatnot.
Awesome. So you are clearly a person moved by curiosity. And what made you curious about the medical profession and the medical sciences, and eventually into neurosurgery?
Right. Growing up in India, it's been a wonderful childhood, I would say, looking back. And I've grown up in a household where science was a very interesting topic brought about from when I was a kid, from my grandfather, who is actually an engineer. And so he started inculcating small experiments in our day-to-day activities, like playing as we were children. So that really brought out the curiosity in me. My dad is also a doctor by profession, and so seeing him work on such a close basis made me really grow towards medicine and becoming passionate about it. When I started entering my high school years, I found that science is a wonderful subject where our logic and our minds, our cognitive abilities really used. And so that really interested me. And in this whole universe where you can learn anything and everything about how things work, starting off by learning and understanding how we work is a great step in changing the world of medicine, I would say. So that really got me kick-started into my medical career.
Awesome. And how does medical school work in India?
So the medical school in India is a 5.5 year program. So in unlike many other countries in the West, we join off as 17, 18-year-olds at that tender age. So we're put at a fork at around that time to decide our career paths, either engineering, becoming a doctor, or any other path. So around 1.7 to 1.8 billion medical students, actually undergraduate students, write these exams to get
Mhm.
into medical school, out of which there are around 98,000 medical seats in India, in around 680 medical colleges, as per the National Medical Council, which is actually a statutory body which monitors and maintains the high grade medical education in India. So you write this one entrance exam and get through. If you're within the top five bracket of this competitive exam, and once you start, the medical medicine in India is a wonderful profession, and it's a wonderful journey for a medical student, I would say. So the whole course is spread about into 5.5 years, where the first year you deal with basic subjects like anatomy, biochemistry, physiology, following which you go into path, pharmac, microbiology, forensic, and the third year is ENT, ophthal, and community medicine, followed by the major clinical subjects in the final year. So surgery, medicine, obstetrics and gynecology, pediatrics, and many other small subjects like dermatology, radiology associated with them. So in India, it's been an amazing journey for me as a medical student. I just finished my fourth year of medicine, and I've started off my internship where I'm actually now interacting with patients on a day-to-day basis. So it's it's been a truly wonderful journey. I've enjoyed every bit of it, from being a normal science graduate, undergraduate, to becoming a medical student was a big transition, I would say, in every way. Starting from the day we walked into the anatomy dissection hall, where suddenly we came across cadavers. I mean, I was awestruck and, to be honest, a bit taken aback by the sudden exposure into what this field has. I'm sure, Luca, you also would have felt a similar experience in your first day as a medical student. So all these memories really changed and, in a way, evolved me into the person I am today. And the journey has been good. We have exams after each year, and we pass on to the next year following that. Around the second year time, we're exposed to the hospital, where we actually have simultaneous classes as well as interacting with patients and taking basic history, learning how to examine the patient, all of that. Following which, third year, final year is also that, accompanied by having classes on the theory of the subjects as well.
Awesome. There's so much to unpack there. You talked about basically everything that involves your medical career. So I have lots of questions about this, of course, because
Sure.
as you said, we have very similar experiences emotionally, but our systems work very differently. And I would like to unpack the pros and cons of
Absolutely.
every system. So first of all, you said that you
Right.
started at around 17, 18 years of age, right? Now,
Yes.
it's interesting because Italy is very similar in that respect. Well, in places like the US, people start
Okay.
way later, so they have more time in a way to develop their passions, to understand what they actually want to do before getting into medical school and pursuing a specific career path. What do you think are the pros of starting early, and what do you think may be the roadblocks related to starting that early into a medical career?
Yeah, I would say the pros of starting early is it buys you a lot of time, like 4 or 5 years, which you would have spent as an undergraduate. Learning other subjects could be saved and channelized into one solid career path. And the fact that you're so early, you're so tender at this age, is that you can really groom yourself to grow with the system of education which you're put into, rather than finding it hard to manage your lifestyle, which you would have kind of developed in your mid 20s rather than your late teens. So that's one of the advantages as well. The cons would be at that point of time, with your mental maturity of deciding your entire career, is again a lot of pressure on certain students, be it in Italy or in India. So we have to really decide what we want. And once we make that decision, I think the road is clear ahead. Another con, I would say, is that people may find who find it difficult back out at this stage and then try to go to other paths. And there are definitely other alternatives, and there's no right or wrong path. Anybody, if they're passionate about anything, can take up anything at any point of time. So I would say, I think it's more of an advantage now that we're in the system and have faced that, rather than a disadvantage.
Awesome. And you said that you work with cadavers early on. That's interesting because, for example, in Italy, we do not work
Yes.
with cadavers at all. I mean, there are a few medical schools that
Okay.
give this opportunity, but here at Humanitas, we do not work with cadavers. And lately
Right.
there's been this debate about how much to use cadavers and how much to research into simulations which may be able to replace them. What is your idea about using cadavers? How was your experience?
So, as I said before, I was a bit taken aback on the first day because we're not used to seeing something uh, like that. But the whole concept of us dissecting a cadaver in India was started off with with the preset attitude of gratitude. So we thank, before we start dissection, we thank the person who has donated their body for giving us this opportunity to learn. And I would say learning from anatomy from a cadaver was really mind blowing, because you could actually see the orientation of every structure in the body, be it the head, the brain, the cranial nerves coming out, or in the thorax, the heart. You can actually cut open and see how things are. So your orientation, the spatial intelligence you develop as you dissect, would be something that is really wonderful you can get. Um, so I really enjoyed dissecting. Initially, anybody would be a bit hesitant to go close to the cadaver and start learning. But once you develop that scientific mindset, which we actually need throughout our medical career, to see a patient or a body as a, just a commemoration of all the organs of life, and view it objectively and not as a person, in a way is helpful, is what I felt. I would say in this world of modern technology where 3D and the holograms are all coming up, it is not unfamiliar to come across, virtual bodies, virtual dissections, and all of those things as well. But nothing like the real hands-on, the cut, the feel of a living experience. I mean, not a living directly, but of the
I'll live
natural
more.
way.
Well,
Yeah.
it's actually very interesting what you were saying at the beginning, because of course a cadaver in most people elicits a huge emotional response. And I think a lot of that has to do that, for example, in the West, I can speak for my own experience and that of my peers, we do not have a daily contact with death at all before we enter medical school.
Mhm.
And I think in a way, working with cadavers is a very gentle way of approaching the concept of death without having to be emotionally tied to the people that die in the first place.
Absolutely, Luca. Wonderfully said. Very
And
true.
let's stay on this concept. Of course, as a physician, we all have to get acquainted with the fact that some of our patients die. We must accept that as a paradigm. How do you deal with it? And do you think that cultural differences within, I don't know, European culture or American culture and Indian culture may make a difference in the way that we cope with these difficulties, which are part of a medical career?
Yes, I would say very interesting question there, Luca. Death is something which is universal, and how we deal with it is subjective based on what we have seen growing up or how we tend to respond to such situations. It's definitely a very sad situation to be part of, which medical students or interns or junior doctors come across when we start working. So my experience in the Indian healthcare system has been that it can go two ways. When the method of how we declare death and inform that to the family or the close people who have come there is very important. So when I worked in the casualty department of our Kim's hospital, there I had to declare a person who was brought dead to the hospital. So there were many people who in denial at that point of time, and the senior doctor was very busy seeing multiple patients and just said, "Okay, get a flat line. There's a flat line on the ECG. Just declare the patient." And I was left to tell the attenders. So that was my first experience in facing this scenario, and I had to break it down to them and try to console them and tell it in a subtle way when they were not really ready to accept it. So it is a scary experience. It is a very difficult way to frame it, or because you can't sugarcoat something which is really sad. So all I'm saying is that people take it in two ways. One is they just break down what I've seen in India, and they just try to leave that situation. And the second one is turn into something violent. They turn the situation into something violent. So especially if it's a pediatric case where you have like a 1 month-year-old baby who's just passed away, the parents sometimes get aggressive and can come and harm you. So there have been many cases in India where the doctors have been, it's sad to say, but they have been abused physically, and gangs of people come in mobs and just beat them up. So as
Wow.
a healthcare provider in India, we have, or anywhere across the world, we have to, stay on our toes, be very careful and cautious about what we do. And I think a message for all the viewers across the world would be that documentation is very important. Every step of the way has to be documented so that people don't mistake like you not documenting things as as a blunder you have done. Or we have to inform people at every stage, be it in ICUs as well. When we have patients coming in India, we inform the attenders that this is the prognosis. There is so much percent chance, even though we can't give it to you in black and white, there is a high grade chance that this is a very serious illness and the patient may not make it. So we have to acclimatize them to that. And another thing in India, I would say culturally, what they believe is people consider doctors as almost next to God. There's a saying in Sanskrit which says, Vaidyo Narayana Harihi, which means that a doctor is actually God in himself. So Narayana is one of the forms of Vishnu. So Hindu people in India actually consider doctors as God. And so whatever you do, for most of the people who are uneducated here, it depends on which strata of healthcare you are in. So I'm in a medical college where I get a lot of uneducated patients as our regular patient load. So for them, understanding what exactly the disease is and trying to give them a holistic picture is a bit difficult, coming from what background they come from. So they just consider whatever we do is the statement. So in such cases, it's really difficult to convince them and provide them a holistic approach or a holistic picture of what really is going on. So I think that way people are have a lot of faith in God, I would say, in India, and they just, you can see people praying outside ICUs, breaking down, going to temples. Even a fun fact is, even, I mean, it's not a fun fact, it's it's just a statement
Fact.
I'm trying to say is that yeah, a fact, thank you. A fact is, in our hospital itself there is a temple inside the
Oh,
premises, so
really?
a lot of patients and attenders, yes, a lot of patients and attenders go there and pray for people. So yeah,
That's
faith is something which really drives India, I would say, Luca, and it's something inbuilt in our blood. And even we as doctors have to convey to the patients, we are not gods, we're not here to save a life, but we're just mediators who actually make curing or make the patient's prognosis better. We're just puppets in the arms of, you may call it God, everyone may have their own. It's all the same, to be honest, a supernatural force which is beyond our comprehension, who actually takes care of things. Because as logical people, there is something beyond ourselves, is what I believe in, whatever you term it. So
well,
yeah, that's
that's
about how people are in India.
that's amazing. That's so much to unpack. I've got so many questions and so little time. So, with regards to what you said about mobs and the fact that you do have a mob mentality when a doctor, which is akin to a god in a way, as you said, it lets down a patient.
Hmm.
Do you think that it's specifically in a culture such as that one, it is even more important to deal with medical education? So, teaching not only doctors, but the general population about the limits that we as humans have in the potential to treat and the potential to cure patients.
Absolutely.
And
So,
yes,
uh-huh.
yeah, you would you like to elaborate on that because that's fascinating to me.
Yeah, absolutely. I think from the standpoint of the trends in India, what we've seen over the past 40 years, to look back, is there have been a lot of medical health programs which the government of India has implemented to make sure that all the population understands the major problems, especially locally as well, because India is known for as being a hub of infectious diseases. Maybe not as much as those cases which we see on a day-to-day basis are seen in European countries or the US or Western world. For example, our pediatric wards, if you take a walk with me on a Monday morning through our pediatric wards, you may not be surprised to find about 10, 15 dengue patients or people with malaria or any other rickettsial infections and many other diseases which are very endemic to India per se. So the whole idea of infectious diseases booming in has made India try to create personalized programs for eradication of these diseases. For example, the revised National Tuberculosis Prevention Program, which was
Mhm.
a program started off by the Ministry of Health and Family Welfare in India, which basically tries to eradicate the tuberculosis disease, which is very rampant throughout India. Any immunocompromised child, any malnourished person, not even a child, all age groups. It's very prevalent in India. So these programs, National Leprosy Eradication Program, National Malaria Eradication, all these programs are in full swing, providing a systematic protocol for any diagnosis, for catching patients anywhere across the timeline of the disease, be it preclinical, clinical, or full blown out chronic phase of the disease. And these protocols are very standardized so that any patient can be tracked, and even there's something known as DOTS, which is direct observation treatment protocol, where you actually provide drugs directly to the patient, and you monitor their intake for eradication of TB. So TB is rampant, and other even non-communicable diseases such as diabetes, hypertension are very prevalent in India per se. So I would say the cases we face in India is very different, and our OPDs are flooded with all these patients. And also on a day-to-day basis, if you would like to have a picture of the Indian healthcare system, I would say that if you're sitting in an OPD, around 100 patients would come to our hospital as well, or to any place. So you would just have to take a quick history, do a brief an important exam, and then come up with a diagnosis and manage them. If they're a bit serious, then we just admit them and then work them up and then come up with a diagnosis within a day, and then start that treatment protocol. So I would say the efficiency of the system is very good, even though it's in pockets. And the whole system is like a triangle. We have in the base of the triangle is the primary healthcare centers, which are prevalent across India, which actually take care of the masses. So for every 20,000 primary healthcare centers, you have a sub-center, and then you have the community health center, then the district hospital, and then finally in the peak, you have an epic center. So this pyramid acts as a level of referral as well. If you're not able to handle the major cases, you can refer it there. So the Indian government has actually done a lot, I would say, in the healthcare, be it in terms of immunization of all the patients of the children, because of all these communicable diseases. We have hepatitis B, we have all oral polio vaccine. Polio is almost going off, I would say. In another 10-15 years, polio may not be even prevalent in India because of such a good immunization system and detection of this periodic paralysis which happens. So all these diseases, malaria, measles, mumps, rubella, all these infectious diseases are covered to a large extent through this great immunization system. And also, I would say that the maternal and child healthcare programs in India are very impactful. The government provides in the government hospitals in India an ambulance to pick up the mother, drop her off, as well as complete free treatment for getting an institutional delivery. Because many places in rural India don't believe in delivery in a hospital. They feel it's a natural process. And because of that, the maternal mortality rate had peaked up about post-independence era, which was the 1950s and 60s. And so we had to come up with all these schedule schemes to actually help reduce the maternal mortality rate and also the infant mortality rates. So I would say overall, it's a good picture in India. There is a lot of, the economy is also growing, and there's a lot of funds going for all these. About 2.5% of the gross developmental product of India is being used for healthcare, which is pretty good compared to other countries.
It's a
So
lot.
overall, it's a good picture in India. Yeah.
That's amazing. I mean,
I would say.
I do believe you have an incredible density of population, which is, of course, a factor that
Yes.
must increase efficiency, because if you do not have incredible efficiency, you won't be able to cure anyone. I mean, having 100 people in a clinic on a daily basis is a lot of work. So I have a few
Yes.
questions related to that, but one of the main ones is, how do you believe that having to deal with this many patients changes the way that you act in a day-to-day life as a doctor? I mean, do you have a bigger emphasis on diagnosis maybe than other countries? And could that maybe even help you translationally across fields and maybe even outside of India if you decided to go somewhere else?
Yes, it has a huge impact. As a person seeing all these patients, be it at whatever level we are, as an intern, we just see an OPD patient and then write their history and then do their examination. But the senior doctors in our hospital, we present the case to them, and then they advise a protocol, or they give a diagnosis and help treat the patient. So at whatever stage you are, be it an intern, a postgraduate is what the next stage of training is for a medical student, or a senior resident or a professor, whichever level, or even the HOD, you have to follow a systematic protocol which is set up by the hospital. And I think it's common as well where you do in your hospitals as well. So as soon as you have a patient come in, you take their history and then you admit them and then work them up. So all these things, the nitty-gritties of it is what we learn as a medical student. And I would say the whole, even though we feel that there are a lot of patients, the efficiency is built up because of these protocols. So we just follow the protocol and we come to a diagnosis. And I would say that there is definitely a huge caseload. I mean, the rounds, sometimes the ward rounds which we go to, go on for hours on some days. And in those rounds as well, the professors, dig deep into and question each step of why we did what. And sometimes it can be just a roasting session for most postgraduates as well. So it's all good. I mean, the education system is also simultaneously growing with the patient load, and we try to get into colleges which have a higher patient load so that we get exposure to a wide variety of cases. So ideally, as a medical student, you'd want to get into a government hospital, but even private is pretty good now because of so much population. So a government hospital is where you yourself run the entire department almost. Right now, I'm working in a government hospital, which is just around the corner, Jayanagar General Hospital, where they see around 1,000 patients per day in their OPDs. So it's just flooded with patients. And I was in the obstetrics and gynecology department, Luca, where we had 20 women lined up outside. And there was a senior professor who would just quickly do their per abdominal examination, just see, okay, she's 38 weeks, like her adequate, all of that in terms of OBG. And then if there's something major, she'd keep her aside. So that way she could go through around 60, 70 patients in 2, 3 hours. So the efficiency of it really builds up, and even their skill set, as a surgeon, your cutting of the knife really shows how well you are as a surgeon. And she just cut it like butter, I would say. So, like, you doing more and more cases, you get really good in your surgical training. And I would say that way, India is probably at par or even sometimes better than most of the leading developed countries. So, even though we have a good caseload, the summary is that the efficiency of it is good in a certain way to handle that.
That's
Some disadvantages of it is that you may not be able to spend as much time on one single patient than you would have. So I think that is the one disadvantage. But major overall, the whole system runs smoothly.
That's absolutely amazing. I mean, I find it very fascinating how every health system adapts on the basis of its population. And many countries in the world, for example, the US, the private system in the US is shifting, not even slowly, very fast, to a personalized medicine system, a system in which every patient is cured on a personal basis, not on the basis of protocol, but on the basis of physiological markers and biomarkers. Do you believe that this will eventually be integrated inside the protocol managed system in India, or do you believe that it's just two very different systems that are difficult to reconcile?
I think it is a personal, I mean, it is overall we follow the protocol, but it is a tailored fit with respect to the patients. So these protocols which I was talking about are more for these national health missions where you have these at the most grassroots levels of the country. So the whole concept of these missions and how they changed India was the decentralization of the healthcare system. That means, like, we don't have doctors at the most basic level. We have somebody else, like an auxiliary nurse, midwife, those sort of people, or a healthcare worker who are actually local people over there who are educated that follow these protocols. When they come up to a district hospital level or a community healthcare center level or a diagnostic apex center, there you do follow the same system of healthcare as you would in the Western country, where it is definitely based on what the patient is presenting in with, and we completely go in the route of his or her symptoms progression and get only the relevant diagnostic techniques to come up to a diagnosis.
Well, that sounds extremely interesting. It sounds a bit like an appeal system and a judicial system, right? I mean, you start with the very basics and you exclude everybody that doesn't need subsequent care or further care. And then you deal very specifically and very in a tailor-made manner with the patients that do need a tailor-based approach. And that is very
Yes.
interesting. Wow,
Yeah.
awesome. I recall.
And I feel,
Yeah.
yeah, sure.
Yeah, no, just
Go
finish.
ahead.
Don't worry about it. Go ahead.
Yeah, I think the main answer to your question is when we have strength in these bottom tiers of the pyramid, then automatically all the tailoring would percolate down to that level as well. Right now, the if you see like the need and what is being met at these levels, it is still a lot to be covered. Like we have a continuous load of patients, obviously in obstetrics and pediatric departments, but the other diseases which we can really prevent, especially non-communicable diseases like diabetes, hypertension, these all diseases we're trying to reduce in this lower set of the pyramid just by health promotion and prevention. And these concepts are actually not really foreign for us. Like Ayurveda, which is the knowledge of life, which is actually the oldest school of medicine, was originated in India. And that actually mainly dealt with trying to prevent diseases. So it's a fun fact that there are two pioneers of Ayurveda, which is Charaka and Shushruta, who really modernized medicine about 5,000 years, 7,000 years ago, around 5,000 BC. So these people actually they had studied enormous amounts of literature, and they came up with two books, Charaka Samhita, Shushruta Samhita, which actually gave Charaka was more of a medicine person. He gave around 100,000 herbs, medicinal herbs, their value and how they can be used in prevention of diseases. So a common thing is that Indian food is spicy, but actually those spices which we use have each of those spices have its own medical property. So he came up with that book, and that has been even followed now in certain schools of medicine which are prevalent in India, which is Ayurveda, Unani, Siddha, all of these medicines. Also, Shushruta, who was the father of surgery, had actually made his book Shushruta Samhita, which he compiled around 300 surgeries and around 125 his own made surgical instruments. So all of this goes to show that things like preventive medicine have been there, and it's been there across all the countries as well, in ancient Egyptian or Mesopotamian or Greek um, healthcare systems. There have been evolution of all these things which throughout time has come up with the modern aspects of healthcare coming up in the 21st century. I think all of this just goes to say that we have to look back and take note from history that it's always been there and implemented today.
I agree 100%. I think, for example, in Italy, but in Europe in general, we have less attention to medical history. And I think it's beautiful that you have such a profound connection to your roots and you're able, to cherry pick as well things that worked and things that didn't work in order to implement it into your
Absolutely.
current medical profession. A question I have about that, which I think is interesting, is do you have any of Eastern and non-traditional medicine we may say in Europe, which is taught in curricular activities during medical school?
Yeah, actually, that's an interesting question there, Luca. There has been an implementation of us being posted as medical graduates into these clinics, Ayurvedic clinics or departments. I've not yet experienced that firsthand, but some of my colleagues have gone there, and it's good to have a holistic approach. Although right now modern medicine is being used to treat emergency conditions, there are aspects we can cherry pick, as you said, the best parts of each and integrate it as well. And there are specialized courses in India which you can do to become an Ayurvedic doctor, to become any of the other school of medicine doctors as well. So you can do that. And nowadays, those people are also having a say to conduct surgeries, to do basic medical treatment as well. So there has been a huge change, I would say, in modern healthcare in India, where they're trying to equalize our conventional medical standard degree, which is almost internationally equivalent, with these schools of medicine. But we don't know how proficient those people are to handle emergency situations. And hence, I think working together is something that we have to inculcate, because we don't have the skill set they have, and nor do they have what we do. So working together would be the best option.
Well, that's beautifully put. I mean, I believe that in Europe we have a feeling, which is, in my opinion, completely wrong, that traditional medicine, as we may call it, and Eastern medicine or Ayurvedic medicine, or however you may call it, are mutually exclusive. But I do not believe that to be the case. I mean, I think we just deal with
Absolutely.
different things, different pathologies from a different point of view, and working together is the best way to to do things better, you know, and to learn from each other. It's very, very interesting.
Absolutely, Luca.
Yeah.
Yeah.
And I recall you saying that in the fourth and fifth year of medical school, you start
Mhm.
prescribing drugs to patients. Is that true?
Uh, yeah, not as a fourth or fifth year, as an intern. So once you finish your 4.5 years, you become an intern, or the house surgeonship is what they call it. So yeah, you get to prescribe medicines, and of course under the supervision of somebody.
Mm.
But you can officially sign a prescription at that point of
Oh, really?
time.
And you'd be around 22. I mean,
Yes.
best case scenario. That's very interesting.
Yes.
In Italy, we do not
Yeah.
have the ability to make such important executive decisions that early in our medical career.
Okay.
You believe that that has an
Mm-hmm.
advantage later on in your professional career to
Mm-hmm.
be able to make these executive decisions very early on.
Well, I would say that even though we are given this liberty, we don't really use it because we're always in an institute where we have to report to our seniors, senior
Mhm.
doctors, and again follow some protocols. So we are at definitely at a point of reach to the patient, but we directly do not provide our treatment protocols or whatever we decide to prescribe. It's always showing it to a senior doctor and then getting that approved and starting that. So if you come out as a medical graduate after your degree, which is in India called Bachelor of Medicine and Bachelor of Surgery, in short MBBS, as a MBBS graduate, you can prescribe. You can open your clinic next door and have patients coming in and prescribe. That's not at all illegal, but it all depends on how good you are technically. So I'd say most medical students don't stop at that level and they go on to pursue a postgraduate medical education either in surgery, medicine, OBG, in all the 19 subjects, you can pursue. And then in that, you're trained specifically in those departments where you excel and become good and proficient enough to treat most of the cases in that department, I would say. So most people, I would say about 90% of the people post MBBS, they go in for these things and then they continue their medical education, not just stop at that level to
Of course.
prescribe.
I mean, in Italy, for example, we have an abundance of medical students that got their degree, so medical doctors, but we have a paucity of postgraduate medical students or medical specializing students because we have issues with payments, and it's very difficult to lead a life of quality while pursuing your postgraduate degree. I was wondering how the situation is in India with regards to postgraduate education.
Postgraduate training in India has almost become a necessity because people just don't stop at their MBBS degree. Your work you get as an MBBS doctor would be just to monitor patients in any ward or hospital you wish to join. So most people would prefer to do a postgraduate degree. So coming into some statistics, around 98,000 medical seats are available in India for undergraduates, but to get into postgraduation, around 42,000 as the latest NMC says. So half of the people are just ruled out there. So the number of seats do not match. So the competition is pretty high every year, and many people take 1 or 2 years after their medicine to actually study for these exams and give it a go because of the level of competition, be it their financial condition. Yes, you do have government seats, private seats, and other management seats where you have to pay and get in. And many people can't afford it. Like you said, it's a very difficult thing for a lot of people here as well. So people spend a year or two working simultaneously to earn and stand on their own feet as well as to study and then go and pursue higher education in India. But most of the people do pursue, and it's not just postgraduate training programs which happen in medical colleges. There are also a whole set of other programs you can join as an MBBS graduate, which is a diploma programs. Diploma of National Board is a whole other vertical, which happens actually in private hospitals where you get exposure to patients, and you can even do other programs as well. So I would say that it's become a necessity, but it has become a very difficult situation in India because of the numbers and the level of competition. So people study 1 or 2 years and then give it a go.
Mm-hmm. Okay, that's very interesting. So, with regards
Mm.
to your own city and where you work, you said you work in a private hospital, I have a public hospital, a government-based hospital. But you also live in
Yes.
Bangalore, which is one of the most advanced cities in India. It's, an IT hub for the entire world. It's the science capital of India. I was wondering if you have experience in rural communities. I mean, I imagine that medicine in rural communities is very different, and it's a very different reality compared to what you are exposed to on a day-to-day basis.
Absolutely. So, being born and brought up in Bangalore and being studied in Kempegowda Institute of Medical Science, which is a private medical college, our exposure to rural healthcare systems was through camps. So medical camps are something which are not very uncommon in India. So a group of medical students are sent out to these peripheral locations from a third tier city area or a higher center to these places where we actually go and screen patients and then bring them back to these centers and provide treatment. So again, affordability and who are providing these camps are one thing. So from what my experience has been is there are many NGOs, these non-government organizations, which are actually trying to promote all of these camps to help screen patients. So what we do in the camps is screen for major diseases which can be preventable at an early stage. For example, in India, screening for cervical cancer through pap smear has become almost a protocol in most of the cities, states of the country. So we go out, do pap smears, get their cytology, and then evaluate, and then call them back if there is, a carcinoma or, carcinoma in situ also. So we prevent at a early on point, as well as can for simple things like doing a random blood sugar at a peripheral place would kind of group patients into pre-diabetic, diabetic, or non-diabetic, or doing a basic blood pressure monitoring can screen for hypertension, and all these things. I myself had gone to a cataract camp where we actually went to this place periphery in the periphery of Bangalore, where we saw a lot of patients of a certain community and screened them for cataract. So they came in masses. Again, these camps are all about numbers and trying to screen as much patients as possible. So I think that day around 400 patients had come, and we just quickly did an eye examination. We did visual acuity, just a basic torchlight, just tried to make out which stage of cataract it was. And then we try to rule out conditions which hamper the treatment of disease. For example, if they have any blepharitis, or if they have anterior inflammation, iridocyclitis, or anything, we try to rule them out and ask them, finish this course of medication, clear that out, and come back. We will provide the surgery for cataract. So these patients, around hand few of them were selected from these 400 patients, and then we brought them back to KIMS, where we performed these operations at a very marginal cost and then sent them back. So things like this are really touching in the sense, especially when it comes to vision, because once you restore a person's vision, it brings a lot of goodwill and faith, and it's a wonderful change for that person as well. So it was really wonderful being part of these camps. We In all departments. So when I was posted in orthopedics, we went on orthopedic camps to places in the city as well as outside of the city. So even in the city, we have different areas and different strata of people. So we try to help the poor people at a very marginal cost. And we have many sponsors who provide free medications, who provide free treatment for a lot of these patients. So camps are a way we get to know the reality, the ground reality of the rural healthcare system, because at many points of time, these patients do not even know that something is wrong, and it's only until the very late end of the disease they actually come and show up, where not much can be done, be it in cancer, be it in even non-communicable diseases.
Well, that's very interesting. And do you believe that in the future, since you are affiliated to Mission Brain, you would like to use, in a way, Mission Brain as a vehicle to bring it to local communities in India to be able to make a difference, even from a neurosurgical perspective? Because I
Yes,
imagine that
absolutely.
in very rural communities, it's very difficult to provide quality specialized neurosurgery for rural communities.
Yes. Yeah. I would say yes, definitely we can incorporate whatever Mission Brain has, the ideas, visions. The whole thing about Mission Brain is to treat, educate, and empower, which has to actually percolate throughout the world, not only in India, to all stratas of people. So, I mean, it's truly inspiring seeing Dr. Q and Dr. Michael Lawton actually go to places in Mexico and set up a protocol and treat patients at no cost, and provide such level of expertise at different pockets of the world. And we would love to have them come here as well, and you know provide their valuable input, and look at things in a different point of view. Of course, they come from different systems of healthcare, and what we have here is totally different. So we can learn and pick the best things of both and try to incorporate new methods. Uh, and camps have been something we, Mission Brain India, as well have been doing regularly in association with another NGO, which is Aveksha for Seva. So the Mission Brain India core team decided to start this NGO because, as part of Mission Brain India, we didn't have the right to start treating patients here. So we actually created this collaboration to have the ability to reach healthcare to these patients in a rural setup. So we started off a small clinic in a small district in Karnataka, where we actually see patients, and it's been running around for around 8 months, 8 to 9 months. And we're seeing patients on an OPD basis, and we conduct medical camps. We get interested medical students to hop on, come to our clinic, and screen patients and provide treatment. And we also try to reach out to sponsors to try and actually provide free medicines, so that the poor patients don't have to spend as much. And if it's a major condition, at least we're educating the patient and screening them early on and trying to provide a referral for them
That's
with respect to
fascinating.
anything. So I would say, yeah, it's been a wonderful journey so far. Dr. Shreya, who's the president, Dr. Swati, who's the vice president, and myself, Neha, as the treasurer, we three have come together with numerous hands of the entire Mission Brain India team, Dr. Kaushik, Dr. Rohan, Dr. Vindhya, Dr. Ramya. All of us have come together, like minded people, and really thought about how we can impact and change healthcare in India as medical students or as just a graduate. And so this and of course we have doctors volunteering in these clinics. So we had many of them who came in for a few months and provided their input and actually lived in that rural setting despite all their difficulties. Of course, being born in the city and getting used to the urban lifestyle is completely different from living in a peripheral setup where you don't have any facilities, and simultaneously studying for going abroad or for your higher education. So I would say that all these camps happen from Mission Brain India side, and it's truly been exciting to actually have an impact on a person to person level, which I feel all of us can do, be it from anywhere you are sitting across the world. You can actually help out, and we want to provide make this clinical experience into rural setting into a virtual space where even you sitting from Italy can log in and interact with patients. We can have a translator, so you get on a personal level the experience of how healthcare works and in rural India. And
That
that
would
would
be
be our
so
next
cool.
project.
Wow,
Yeah.
that's
Mhm.
amazing. And is this clinic that you have been running for 8, 9 months completely student led?
Yes, it has been completely student led. I mean, a graduate led. Because as a medical student, you're not allowed to, run a clinic. Once you finish your medical degree, which is your MBBS, you're allowed to open your own clinic. And so we have definitely touched the lives of that local area, and also people come in from the surrounding villages just to get treated or referred from our clinic.
It would be
And all
amazing
of
to
this
have,
was with the support.
of course, it would be amazing to have uh, surgeons from the Mission Brain Network all around the world collaborate. I don't know, a few weeks or a few months a year in your clinic. That would be amazing. And I would love to
Absolutely.
create a collaboration between our chapter or Mission Brain Italy, Mission Brain Europe, and yourselves to see if we can do something together. This sounds absolutely insane to me.
Yeah.
And what do you believe is the
Thank you.
future for your chapter? I mean, you started it when it was basically nothing, and you took it to, a big chapter that has achieved great things, which is, it's running a clinic. What is the next step, in your opinion? And how do you think you can promote international and global cooperation between chapters and among the entire Mission Brain Foundation?
Yes, so the journey so far has been a good one, Luca. And I think prospectively looking forward, we would love to be more networked and it should be like a community. I think that's what Dr. Q and Dr. Michael envision, that the whole Mission Brain community should help each other grow, be it in any um, field possible, especially among medicine itself, the subfields. So I would say, looking forward, we would like to get into research and try to, collaborate with people, because the caseload in India is a lot, like the number of patients you see. So for data and statistics, we are really good with that in terms of patient load. So research can be a huge thing we can collaborate with, and also like trying to provide a platform to improve the patient health education, be it in our local languages or providing patient information videos or pamphlets in rural India would really help. And of course, collaborating with respect to neurosurgery. So we actually, as the Mission Brain India chapter, collaborated with one of the great institute in India for neuroscience, which was NIMHANS, National Institute of Mental Health and Neurosciences India, which is one of the best institutes, even across the globe. So we tried to coordinate with the head of that, which was the chief, Dr. Dwarkanath Srinivas, who is the head of neurosurgery, and we wanted to connect him with Dr. Q and Dr. Michael Lawton, and they were very keen. And in the name of Mission Brain, we wanted to host a conference, actually, a in-person conference in India, and fly Dr. Q and Michael Lawton, and of course, every single person of all the Mission Brain chapters into India, and have a look at how neurosurgery runs in India at this apical center. But unfortunately, because Dr. Q and Dr. Michael Lawton were busy this year, I think for now they won't be able to make it. But definitely in the near future, we would love to host an in-person conference. And not only that, we just want to impact um, Mission Brain's ideology into as many people as possible, get more people into this organization, help create an awareness mission, help roll things, and help network and just make things more free flowing. I think there are a lot of pockets across the world, centers of excellence and different things that as what we can do as medical students or as graduates. And collaboration is the only way forward. We have to collaborate with each other, we have to build projects together, we have to do things which will uplift and help augment each other's realities into a better one, I would say. So networking, collaborations, doing global mission brain events is the way forward, I would say. And it would be wonderful to have the entire Mission Brain team. We would open all of you with loving arms and have you here, hopefully for a in-person conference, I would say, coming soon.
Wow, that's amazing. I mean, and I think this tells a lot about the podcast as well. We would love to participate. As you may know, we participated to the mission trip in Mexico City, telling the stories
Yes.
of the local neurosurgeons and the visiting neurosurgeons and the nurses and the patients. And it would be great to participate to something analog or of this degree in India as well when you organize it. So it would be great if you kept in touch about this. This is awesome.
Absolutely. And I
Uh,
think regarding what you guys are doing, like, the podcast, trying to get everyone's voices heard, starting from the big players in neurosurgery like Key Park, or even a simple medical student graduate like me, an intern. It's so wonderful that you're doing this, because I would love to support you in any way forward. And you have Mission Brain India support for this. And voices heard are something that really changes your perspective about global trends, about latest advances, because all of us are on the same boat but in different seas, I would say. So trying to navigate through would really help us grow in many ways possible. And who knows, like, you, Luca, may be the next Robert Koch, and I may be the next Alexander
That's a
Fleming.
big
So
stretch.
we can actually not at all. I think we have the potential to become great and actually provide a wonderful impact to our healthcare field. And the best way forward is through holding hands and collaboration. So we're all in from our side. And as a person who conducts interviews, and it's wonderful to be interviewed by you. And I would say that it's really nice to see all of this. And um, as I said before, like everyone's voice is, everyone has their own importance. Even in our Indian healthcare system, I would say we respect everyone from the sweepers in the hospital to the, director of the hospital. That culture, that thing, the service mindset as an Indian is what I would love to bring global and make Mission Brain India something uh, so collaborative that there shouldn't be any chapters. We're all one family and we should just make things go ahead.
Well, you know, that is the point of the podcast. That is precisely what we're trying to do. I mean, I also believe that
Yeah,
many times we forget that people like Dr. Lawton that I've interviewed, Dr. Quinones, which I will interview very soon, and Dr. Key Park were once students such as ourselves. They were clueless about
absolutely.
their lives, about what they were supposed to do. And that is why I would like to hear, and we would like to hear from everybody, from medical students, from nurses, from physicians, from patients, and that is precisely what we're trying to do with the podcast, bridge this human connection that sometimes isn't seen between people from different paths of life, which all can come together and really do something amazing, something great, and make an impact.
Absolutely, Luca. Wonderful.
Nia,
Wonderful initiative.
it's been great talking to you. Regretfully, we don't have enough time because we're in a hospital and we don't have rooms for all this time.
Yes.
But it was such a great pleasure being here with you, listening to you, picking your brain, and I can't wait to talk to you again. I
Thank you
hope that
so
our
much.
audience will appreciate your insight on Indian culture and the Indian healthcare system. And I can't wait to talk to you again about some new initiatives that I'm sure you will able to do with Mission Brain India.
Absolutely, Luca. It's been the pleasure's been all mine. I mean, it's wonderful connecting with you, and I would love to, even know your side of the story, how your medical journey has been. Maybe in the future we can have a podcast on how you guys work, because we would love to listen to that. And about networking forward, it's been a wonderful opportunity. And overall, my message to any of the listeners or viewers out there would be that all of us have potential and all of us have the opportunity, I would say, right now to create a huge change. And we have been guided by legends among ourselves, like Dr. Q, Dr. Michael Lawton, who have actually given us a platform to excel. And not only now, even eons before, we've had great people in our own respective cultures. And we have to take the best of all of that and create an impact. And all of us have a potential to change and mold healthcare, not only at a patient level, which itself is very sacred, but also at a broad, holistic level where we can affect millions and the future generations as well. So, all I would like to say to all the medical students out there is study hard, understand your concepts, have a holistic view, and always have gratefulness in you to have become part of this profession, because not everybody can be a doctor. And I think from Dr. Q's life story itself, we've seen that how gratitude and how coming from such humble backgrounds really changes you and makes you the person you have to be. And I would just like to thank you, Luca and Alice and Cecilia and all the people of Mission Brain Humanitas chapter for having me today. And also, I would like to thank my family and my support system, Mission Brain India team, and everybody here who have supported me in my endeavor. All the best to everyone. And thank you so much, Luca, once again.
Neha Rao, everyone. That was awesome. Amazing.
To be interviewed and for inquiries, email us at podcast@missionbrain.org. To donate to the foundation, please visit www.missionbrain.org.